Watch QS24 without commercial interruptions on Wikisana and use the world's unique AI search query. Ask your individual health questions and benefit from exclusive broadcasts. A warm welcome, dear viewers, to our program, Natural Medicine. Today, I am pleased to welcome Dr. Harald Burgard. He is a specialist in internal medicine and president of the European Academy for Gold Implantation, a procedure that is incredibly effective, but unfortunately not yet well known. We're changing that today, and I will show you a film where the mother of Alexander Glock, my boss, received a gold implantation in her left knee. And we will see how it happens, and I will ask all the questions that you might still have to Dr. Harald Burgard. Stay tuned. Hello, dear Harald.
Hello, Sylvia. Good morning.
I am very happy you are here, because in the preparation, when you sent me all those stories, I saw you have such a careful working method, because I always find it great when I get to interview doctors who really think outside the box, include different procedures, because I believe that today the burdens of people are so diverse, you have to consider everything, and I find that really great. You told me, now, in the preliminary conversation, that this hasn't been around for long, the gold implantation in humans. It has been known longer in animals, and when I hear such great success stories, especially in relation to pain, I wonder, why is this not more widely known?
Yes. So it has been there for a long time. If we assume that the first gold implantations in animals took place around the late 70s and from the beginning of the 90s in humans by Dr. Kierkegaard, who introduced it as the first person, it has been around for quite a while. But it is the case in all medical fields that at some point things crystallize out, the state-of-the-art will be, and that is usually joint replacement in cases of arthrosis. So of course beforehand may be a scope or something, but most of the time it is joint replacement or spinal surgery for spinal conditions. I always try to cause as little damage as possible with everything I do, or to postpone operations as much as I can, because of course even with an operation, with a joint replacement, not everything always goes well. We have between 10 and 25% revision surgeries, which means it has to be repeated. There are infections. I just saw a dramatic case right now with my own patient who had a hip replacement that got infected twice and now had to be removed. Now we're in a mess. Sure, there are indications where you need a surgery, no question, if a patient has a tumor in the bone. Anyway, if someone comes in and has arthrosis somewhere where the bone is already practically so soft that it threatens to break, or heavy boulder systems are inside, all the things that cause instability, I would also operate on. But when someone has arthritis, even a severe, fourth-degree one, unfortunately, most of them come too late and actually need to be operated on. Even with severe arthritis, we see that we can achieve a significant improvement or even complete pain relief in a great many cases. But it is still not state-of-the-art. It is not the normal procedure. The normal procedure is joint replacement.
Like much in medicine, it sometimes takes years and decades for something like that, yes.
Exactly.
And how is it then, when, because I just recently discussed this with someone, that indeed also, for example, this idea that I cannot regenerate cartilage is not entirely true, right? And could it also be that if the pain is gone, and when one approaches it holistically, still looks at what the body needs to rebuild the substance so that there would really be an improvement? Or how do you see that? Or is that even true?
Yes. So if osteoarthritis is present, it is usually the case that the cartilage is damaged. And we normally understand that if the cartilage layer is damaged or gone, then it hurts. It does hurt, but it doesn't hurt in the cartilage. And it doesn't hurt in the underlying bone either, because both the cartilage and the underlying bone have no pain fibers. What causes the pain is the joint capsule that surrounds the joint. This joint capsule gets irritated. It also becomes inflamed and normally produces the lubricant that nourishes the cartilage. Cartilage is not nourished like other tissues by arteries, which means by blood, but through pressure and release. Pressure and release. And in this way, the fluid that is in the joint is pressed into the cartilage and nourishes it. Now, if there is osteoarthritis and the synovial membrane, which produces the gel that dampens and nourishes, the cartilage is poorly nourished and continues to deteriorate. And what we can achieve through gold implantation is first, that the inflammation of the surrounding joint capsule decreases, and thus also the swelling, the pain, and usually, again, better synovial fluid is formed. This allows the remaining cartilage to be better nourished. Stem cells often migrate in, just like in all other tissues, where repair is necessary. However, what I have never seen is that cartilage completely regenerates. But this is irrelevant to some extent, because people can, when the pain is gone, also walk pain-free on a joint where there is hardly any or no cartilage left.
That is absolutely genius. And indeed, when you have pain, it gets worse and worse, as you said. That's really great. I think everyone should actually know this because I know so many people in my environment who suffer from such pains.
Yes, so the point is that if I may just circle back, if you have pain, whether in the spine or in the joint, then the pain stimulus causes the surrounding muscles to tighten, protecting the joint. You know this from the sciatica. You suddenly have pain, and then your back is stiff as a board, in order for the segment to be spared and protected. But now, if this protective function, so this stiffening tension of the muscles, and thus the limitations of movement, last for a long time, then the capsule contracts. Then you can't get your leg straight anymore. The hip doesn't go straight anymore. Then people lie in bed. Then you can't straighten your leg anymore. And these are the things that burden you in everyday life. Then it starts to limp, then you overload the other side, then that also starts to hurt. And these are the things we can eliminate with gold implantation. At the moment, the gold works, and the pain decreases, because the swelling, the inflammation decreases, you can move your knee again or your leg, and then people can lie straight in bed again. Maybe one should consider that if a so-called capsule pattern already exists, meaning the capsule has already practically retracted or has contracted, and there are muscle shortenings, simply practice with physiotherapy. Go to physiotherapy, do muscle building training afterwards, so that the whole thing is strengthened and relieved. But when the pain is gone, one can in many cases move the joint normally again.
Wow, absolutely genius. I have one more question. I know someone who also works with me, and she has a bit of diffuse pain. So she has a stiffening in the cervical spine, then she has pain in the hips, and really has pain every day now, right? And if something is not exactly localized from where this pain comes, can one do gold implantations, or does one have to precisely localize what this joint is? Or I don't know if one can also do that in the spine, which is affected, or how does that look?
So in general, one must know what's going on. So when people come, for example, rheumatism have, and due to rheumatic diseases, such as arthritis, having joint pain, then I treat the knot with gold. But I look at where the causes lie and check, do they have any pathogens in the joints? Do they have any toxic metals like lead that cause pain? Do they have other causes? I need to eliminate the causes. But if someone comes in and has a joint that is damaged, hip osteoarthritis, or they have any changes in the spine that are degenerative, facet joint osteoarthritis and such things, or cervical migraine, meaning a migraine that originates from the cervical spine because the cervical spine is arthritically altered, or if someone has fractures in the spine due to osteoporosis that cause pain. These things can be wonderfully treated with gold implantation. Yes, or a hallux valgus, something like that. Yes, but if the cause is a systemic inflammation, then I need to check where it comes from and eliminate it. Then the pain will also go away. I never make gold. I only do that if it's indicated in the case of osteoarthritis.
Great, that's exactly what I mean by looking beyond the plate. We already discussed earlier that people often really have chronic fatigue, pain, or whatever. You start by looking very specifically that pathogens could also cause such pain right now. Hadn't crossed my mind. I think it's really great how you do it. that you include everything.
It's simply necessary. Sometimes people come and say, I have knee pain. Can you do something about it? But they have hip joint osteoarthritis, which radiates into the knee, and it hurts more down there than up here. Or they have back pain, which comes from the hip. You always have to know what someone has and why someone comes to you. If it's clear that they have hip joint osteoarthritis and come with X-ray images, that's obvious. There is also nothing else around it, so you do that. But I always examine the people. I always look beforehand. What do they have? Normally, when patients come to me, they fill out a 21-page questionnaire beforehand, so that I already know what to expect. Gold implantation patients don't necessarily do that, because it's usually clear they have osteoarthritis, or they have facet joint osteoarthritis and have L4, L5, lumbar spinal pain. Then the point is clear, and then you also do the treatment there. Of course, you also have to be sure with everything you do that you are not doing something that is nonsensical, such as a gold implantation in a tumor patient. If there is a tumor in the bone, it does nothing. Or if people want gold implantation because of tumor pain, that unfortunately doesn't work either. But with arthrosis, as I said, with facet joint issues, with spinal pain, with status after osteoporosis fractures, it works excellently.
Absolutely genius. And I have one more question that personally interests me a lot. Into which tissue are the gold implants initiated? Is it in the muscles, in the fascia, in which tissue structure?
So the goal of gold implantation is essentially to eliminate pain, and you have to go where it hurts. That means I naturally don't go into the joint with the gold, then I have trouble. The body doesn't like that, so you go from the outside up to the capsule and place the gold around the joint capsule where the pain occurs. And then cells from the tissue come, releasing particles from the gold, which is called disollocytosis. That's what the scientists named it. And this released gold causes the inflammatory cells present to not secrete any substances that then cause swelling and inflammation. And when that calms down, the pain subsides. It is also often seen that the joints reduce swelling. They don't all come with swollen joints, but often the solutions also come with swollen joints. And over time, that subsides. And it just takes a while until enough gold is dissolved, usually 3 to 4 months. But the process continues for another year, 1.5. And then it stays at the level that has been reached for a lifetime. And to the extent that the gold dissolution takes place, the pain also subsides.
Absolutely brilliant. And these are also the questions that people asked me when I said that I could interview you today. When do these particles migrate? Should one be afraid that they suddenly wander in the body or are in a different place?
Yes, exactly. The question is asked again and again. It is very justified. The gold particles actually stay where you place them. They do not migrate. They do not cause any effect. If I place gold in the knee, it does not affect the left hip. It doesn't hurt anymore on the other side. That really works locally. And of course, over the decades, where they have been doing the therapy already, both with dead animals, when they have autopsied them, it has been seen that gold still sits exactly where it was placed, as well as with humans, who were then x-rayed again after years. It has been seen that it still sits where it is and does not sit somewhere else. So that they migrate is nowhere described. So I consider that to be very unlikely.
Absolutely brilliant. And gold it is pure gold, right?
It is pure gold. It is $9.99 gold, and it works only with that. So no alloy, because one can react to alloys. You have always, again, yes, gold therapy is something old that the rheumatologists know. That is completely something different. What we have done in rheumatology was that we used gold salts. And a salt is something different than the pure form. We use pure gold that causes no allergies, that causes no side effects. We do not use alloys, we do not use salts, but really fine gold.
Yes, and that also brings no burden to the system, as far as I know.
No, because I also do other things and have been measuring in people for 20 years what they have in terms of toxic metals in their body. I can also see if they have gold in their body, if they have anything else in their body. I can see it in the eluate, in the toxophoresis, in blood washing. I can also measure it in the blood. I can see it in the urine after a so-called chelate provocation. I have never seen that people who have had a gold implantation for a longer time had systemic gold in the blood, in the urine, in the eluate. So that seems not to dissolve there. So there are also absolutely no indications of that.
Absolutely brilliant method. And it is, as I understand it, a minimally invasive procedure. So that means no general anesthesia or... Before we watch the film, could you maybe briefly explain how this works? So what is the preparation, especially for people who might be afraid of procedures?
Yes, it's a nice method in that it doesn't destroy anything, because I don't have to cut open anything. Rather, we work with needle techniques and go with the needle to the point where we insert the gold. It's not done under general anesthesia, but under local anesthesia, which has the big advantage that all those who might not be able to handle anesthesia, old people, those with severe heart conditions, people who have breathing problems and would suffer under anesthesia, people with neurological diseases and so on, are not burdened. And above all, you have the great advantage. You come in, I do the gold implantation, you get up an hour and a half later, and go home. You can usually, even on that day, still walking, going for a walk, or whatever else one wants to do, without being significantly affected. There are also no major swellings. Of 15 patients, maybe one tells me in the evening that they needed an ibuprofen, but the others don't notice increased pain. You take off the bandages the next day, can then shower and bathe, whatever you like. So you are not impaired, and the people don't need a sick note. They also don't need rehab. That doesn't exist with the gold implantation.
And how large are these gold particles? So one can also imagine that.
These are small cylinders. They have a diameter of 1 millimeter and a length of 2 to 3 millimeters. So these are small pieces.
And now, especially during the intervention that we will see, how much gold is used, or how tightly are these particles placed?
Yes, that always depends individually on the patient. You can never say that in advance. One examines the person and then determines at the joint, at the spine, wherever one does that, how much is set in there. That can be 20 gold pieces for small joints, but it can be 50, 60, or more for larger ones. But the density and the number are decisive for the effect and also for the long-term effects. That's why I always go in and do as much as possible, but in a way that it doesn't burden the person. You won't notice anything from it, so nothing afterwards either. And the nice thing is that since gold is not magnetic, one can also do an MLT, an MRI afterwards, where normally all hell broke loose then. You can walk through security at the airport. So no matter where you show up with it, you have no problem with it. You don't notice it. You can also do completely normal massages, physiotherapy, everything. Also, injections. So everything that one could normally do could be done if it were necessary.
I am more and more enthusiastic about this approach. So now we don't want to withhold it from the viewers any longer. Maybe we can take a look at how this works.
Yes, so we now see here the mother of Alexander Glock, the owner of QS24. He said back then, "Harald, I want to know if this works, and then we'll take my mom." And we did that. And here you see me and my dear colleague, Dr. Bout, Melanie and Tritzi, who is doing the same thing, who has, together with me, performed the surgery. And here we see that we are examining the knee joint at the beginning. And then, I set the points during this examination. Here are the usual things, stability tests and so on. And then you always look individually, where you need to go, where the pain is. There is a certain topic that must be adhered to, but then you set the respective points. And afterwards, the local anesthesia is administered. And when that takes effect, then of course after that, as with every surgery, it is sterilized and disinfected. Then we get dressed. The actual procedure we cannot show, because you are not allowed to show that, for some legal reasons. And the whole thing takes place under the conditions that one makes a local anesthesia and then places the gold in the respective points.
And the patients, they are not sedated at all?
No,
They also feel the first one when it's being applied.
we are talking to the lady. Here you can see she is conscious here, and we are speaking to her.
Yes,
So the patient is aware of everything. We always do it this way, that 2 staff members are also present. One of them distracts the patient by talking about the world with the people. And I also keep myself informed. I am aware of it too. I then also talk to the people, and the more we have distracted them, the fewer notice that I'm down there studying local anesthesia. And then it's all over in no time. And the patient, he hasn't really noticed much of it. It's just not stressful. And as I said, one staff member associates with me. One entertains the patient, and I do the implantation.
Great. And I just spoke briefly before because she is now in the booth, also with her. I wanted to know personally exactly what it looks like now. And she says it's just great, precisely because the pain is gone. She can walk long walks with the dog again. And I think that's so great. But I also had to ask, because I can also testify to that. She told me about it before, and I think it's such a great method.
We already made a film where she explained it exactly and where she came out. And it's always nice, even after a long time, to find out that it lasts over the years.
Yes, wonderful. And now the question, is there also something like that in Switzerland? So are there doctors? Can you perhaps inquire about that at the academy? Or how would the procedure be if people think, yes, that would be something for me? Where can you turn?
Yes, you can primarily contact my contact address, and we will see who else besides me can do that. Yes, we do recommend someone local, if someone is there. In Switzerland, I don't know anyone who does it. But there aren't really many. And that's maybe the problem on the one hand. But on the other hand, we just have to make sure that we get more people into the country who can do that. So you can inquire with me, and then we'll gladly pass on the appropriate requests.
Wonderful. And it would indeed be worthwhile to make the trip to you if one is pain-free afterward. And then there's the question, this annoying question always, how is it with the insurance? Who covers something, or does anyone cover anything at all?
So with statutory health insurances, we usually don't see any coverage. With private insurance, we always see that the insurers fully cover the costs. But even that cannot be guaranteed. So we generally tell our patients, assume that you will not get anything reimbursed. You will, of course, receive from me a medical report with diagnosis and all that stuff. And then they simply submit that to their private insurers. And we have often seen that it's paid, but sometimes it is not. And why? How? Why not? I can't always tell you either. That has internal reasons.
That might change when more and more people inquire about this method.
However, it must be said that this is, of course, in comparison to a procedure that is normally done when such a knee or hip surgery comes, then the insurance incurs costs of 20,000 to 25,000 euros with everything included. Here we are in a range of about 2,500 euros, a little less. That's a completely different matter. But that's still a lot of money. In Germany, people can deduct such costs from their taxes if they are not retired, so if they essentially have an income and do not get it paid. But yes, it is still not reimbursable everywhere.
Let's hope that changes, also with the spreading of the method, because I think always we are indeed called upon to take personal responsibility. And the more people want to inquire about other methods, I believe, then the system must eventually adapt too. I hope so anyway.
Yes, it is very, very slow, very tedious, also with many other chronic diseases. But on the other hand, if I want to get healthy and what I want to do, then I need a certain initiative. I cannot just rely on the state or the statutory health insurance. The patient is always part of the treatment team. This means they have to want it, they have to participate, and then decide for themselves, do I want this? Can I do this? Will I do this?
Yes, absolutely. And then they can come or do something else. No, it's a scale that is still manageable.
And when one no longer has any pain, I believe, then that is really most confirmed that it is worth it.
Yes, that is great. So it was very, very exciting again. I always learn so much, and I find it great how you approach this and that you are even dealing with gold implantation and that you open up possibilities for people. Thank you very much, dear Harald.
You're welcome.
Dear viewers, I think perhaps you've experienced something similar to me. I am absolutely thrilled. Countless people have come to my mind where I want to pass this on. I hope you were able to gain something from this as well. It was nice to have you here. I hope to see you another time, and goodbye.